In all of my experience, and I have spoken to, of course, probably thousands of clinicians.
Yeah.
I've never heard that question before, Derek. Yeah. So
World of Pain MD podcast is for information, education, and entertainment purposes only. This applies to all information, graphics, videos, and content on the affiliated website and podcasts. The aforementioned does not constitute medical advice, nor does it establish any patient-physician relationship. The information and content on this website do not substitute for any professional medical diagnoses, treatment, or advice. Seek advice from a qualified healthcare practitioner for any questions you have concerning a medical issue, including treatment. Do not delay consultation with a professional or disregard their advice based on the information in this website. The opinions, statements, and views are that of my own and do not reflect those of my affiliated institutions, policy, or any entity.
Hello and welcome to World of Pain MD podcast, where we discuss all things pain with the experts. I'm Dr. Derick Davis, a physician specializing in pain management. In this episode, we speak about radiation safety with Leanne Miller. Ms. Miller is the commercial lead for Burlington Medical's Attenuation Material Division. She works closely with the research and development team in producing new formulas and ways to improve both protection and comfort for radiation safety. She started out selling radiation protection equipment in the UK and soon moved to international sales, including managing all overseas operations. Her efforts as managing director in 2022 helped garner the Queen's Award for International Trade, which recognizes outstanding growth in international exports. In our initial communications, Ms. Miller pointed out a fact we all know: radiation is an invisible presence. However, most of us are still aware of the deleterious effects it can have on our health. Thus, it is important to not become complacent when it comes to radiation safety. I'm thus very appreciative of Ms. Miller's time and expertise in doing this episode and giving me a chance to discuss a topic related to radiation protection, a topic I think we need to talk more of, especially in the pain world. As always, thank you so much for watching or listening. I hope you enjoy this episode and learn something. All right, Leanne, thank you so much for being on the show. I really appreciate your time. We're talking about radiation today, which I think is a pretty cool topic. So thank you for being here, first of all.
absolutely, my pleasure.
So could you tell us a little bit about yourself and how you even got started in the field of radiation?
Yeah, sure. So I went to university in the UK, did a degree in forensic science, and kind of entered my sales career at that point after I graduated because I wanted to work essentially with the living. So I started my career in medical devices, focusing on interventional cardiology and radiology products. And one of the products that we sold into those markets was radiation protection. And that's where my passion for radiation really started. And then ever since, I've kind of worked within this space for the last 11 years or so, branched out into the international markets, and have been leading our UK operation for a number of years. And now I'm on the attenuation material side of our business. So instead of just selling radiation shielding materials into healthcare, we now work with other sectors like aviation, security, that kind of thing.
Awesome. Why did you have a passion, or what got you interested in radiation safety and protection?
I've got to say, I think, during university and during the early years of my career, I was never like, oh, radiation X-rays, fantastic. When you're in med devices and you're selling products that typically always benefit the patient, they never have an impact per se directly on the clinician. And then when you start bringing those products that have a direct impact, and you know yourself how much strain a lead apron can put on you, if you can have a benefit, whether it's your fabric offering and be able to express yourself in that way, or just have a lighter, well-fitted apron, it has such a personal impact on the people that are wearing them, and their passion is kind of infectious, and it kind of went from there.
That's cool. Okay. So it's kind of seeing the passion, how people actually reacted to wearing the materials is what got you more interested and involved in a way.
Absolutely. Yeah.
Okay. Well, what is the easiest way to learn about radiation safety?
I think there's so much content online, like whether you're going to like respected agencies, whether you're looking at your facilities learning hub as well. I think the best way to learn is through others. So speaking with like your RSOs or radiographers, in my experience, they've always been super willing to share best practice and just share their experiences. And likewise, industry reps as well. They're a great resource. In every medical device space, you expect your industry rep to know so much about their products, the benefits, but also, you wouldn't ask one of your like a cardiac pacemaker reps. They wouldn't know anything about their product without understanding the fundamentals of like the QRS complex, for example. And it goes for the same for your industry reps when it comes to radiation protection.
Is there a certain website or book you typically refer to for yourself and sort of like reminding yourself like, oh, there's this and that that I kind of forgot or brush up on?
Yeah, so in the UK, we have the British Society of Interventional Radiographers, but more universal. You've got the International Atomic Agency, where you can have some really great practical advice and podcasts, e-learning, and that's a great place to kind of brush up. So direct people to look at their own local kind of governments and have a look online to see what advice is recent.
Okay. What are the most common sources of radiation exposure in the clinical setting?
So the most common really is CRs. So whilst we see X-rays in different departments like CT or with mammography machines, typically the clinicians are mostly exposed when it comes to CRs, so interventional rooms, cardiac procedures, radiology, of course, pain. And the reason why is that normally clinicians aren't either in the rooms in CT scans or with mammography, for example, the dose is much, much lower.
Yeah. And that differs, like these diagnostic modalities like X-ray and CT, how do they compare to therapeutic radiation doses?
So therapeutic radiation doses, and this certainly isn't my speciality,
Yeah.
but when we're targeting cancerous tissue, we use much, much, much higher doses of targeted radiation. So it might be thousands of millisieverts compared to what is the annual doses for radiation workers or clinicians. It's 20 millisieverts in the UK, 50 in the US. So it's a massive spectrum in terms of the dose output. But for patients, of course, radiation therapy is far more beneficial than the risk related to the X-ray exposure. So for clinicians, it's all about, it's chronic exposure throughout your entire career. And that's the thing where we need to safeguard, your cells with lead or lead-free shielding to protect you.
And I guess like kind of the crux and the heart of this conversation in the first place, and kind of what I was interested in talking about it is, and you had mentioned in our communications is, radiation is invisible, and the side effects of radiation are, not readily apparent, and you have to wait quite some time unless you're getting huge doses. And so why is radiation safety important? I mean, outside of, the obvious cancer causing effects that we know that it can cause, but to you, what does that question mean?
I think it all comes down to DNA damage. So, X-rays, they're always related to cancers or tumors, but we kind of have two different categories of effects, so deterministic or stochastic. And the most common that I've seen is leg hair loss. So a lot of this will, especially males, because you typically have a little bit more hair, will start to notice as you kind of go through your career that some of your leg hair starts to go. Now, that's fabulous if you're a swimmer or a professional cyclist. But what it indicates is that you're getting extremely high at lower leg doses. So there's also been so much research into like neurodegenerative decline, Alzheimer's, and obviously as these publications come out, that means spurs us on to increase the safety.
The thing I worry about as well is the hair on my head. Do you have many clinicians talk to you about that? Is that ever a concern?
In all of my experience, and I have spoken to, of course, probably thousands of clinicians.
Yeah.
I've never heard that question before, Derek. Yeah. So of course we do caps, and there's mobile shields, but the dose beneath the table is much, much higher than above the table. So the X-rays, the photons will travel through the table, through the patient, and then get captured by the image intensifier. So already above the table, you have significantly less dose, because you don't have that kind of backscatter. But we also normally see more room shielding as well that's going to protect the upper torso.
Mm-hmm. The shielding, sort of those sheets that are on the sides of our beds that where the C-arm goes underneath, I find those should be kind of standardized. They should be on all of the tables we have, but that's not the case. I mean, is that kind of what you see as well? They're not everywhere, because that significantly lowers the dosage or the scatter underneath the table.
Yeah, absolutely. So table drapes is what we usually refer to them as. And they can reduce the dose by a minimum of 76%, just having a table drape of a 0.5 millimeter protection. And you're right, they should be standard. It should be standard room equipment to reduce the dose before it hits you. And normally we do see that as standard practice, certainly in those high dose environments like the cardiac, the interventional radiology. You don't see it in those lesser using radiation environments. Sometimes you don't see it in the OR or endoscopy suites.
Yeah.
And they're really quite cost effective pieces of equipment that's going to reduce your total weight on your body as well. Otherwise, you'd have like a full suit of armor from head to toe, which of course you can do.
Yeah.
But to try and minimize the weight strain on your body, especially when you're standing there for hours on end, it's best to get as much room protection as possible.
And just while we're on that, how many of those acrylic shields do you actually, they look like acrylic, I'm not sure if they are, but sometimes they're face shields that the interventional radiologists use. How often do you actually see those?
So we see kind of two different things. So you have like the face shields that are like welding masks that look like perspex. And they are normally acrylic. It's lead oxide usually mixed in with the acrylic. And you have them in mobile shields as well. So you have a section that is opaque at the bottom, then on wheels or casters, and then lead glass that you can move up and down. And they're quite common in most environments. How they're used is the most important thing. So if they're not positioned correctly, they're not going to be providing the same amount of protection as if they're like 2 meters away from you, or not between you and the source of radiation.
Sure. And speaking of proper positioning, the concept of ALARA, are you familiar with that term? What does that term mean?
Yeah, so ALARA stands for as low as reasonably achievable. More commonly now it's referred to as ALARP, so as low as reasonably practical. And essentially it's trying to get the dose as low as reasonably achievable or practical while still gaining the same therapeutic outcome.
Okay. And do you know why it switched to practical, the ALARP, from the achievable?
I think it could be, historically it was always achievable, but we doses incredibly, incredibly low, but to what cost? So the practical, I think, came out as a part that considers the cost implication or the practicalities of it. So I talked about you could wear a complete full suit that completely protects you, but is it practical for you to wear that? Is it practical for your facility to invest in that when your dose may be already very insignificant?
That's fair. Okay, that's good to know. What are some of the more common misconceptions? Like, what are 3 common misconceptions about radiation or radiation safety?
Oh, I think one of the questions that I always used to get asked during training is there radiation still in the room when the operation's over?
Interesting. Yeah.
And kind of a spin-off of that is like, is everything irradiated? If I touch something, am I going to get exposure? So as a bit of reassurance, once that X-ray is turned off, or when your foot's off of the pedal, there is no radiation coming into the room. I think another one that I have heard so many times in my career is, I've had my kids. I can't tell you how many of the more senior consultants will say, I don't need that, I've had my kids. I don't need a table drape put on this side of the table because I've had my kids. And whilst you might not want to have a functioning reproductive system, in your later years, we know that X-ray doses, they are accumulative, and that cumulative exposure can lead to DNA damage. And certainly new research coming out about Alzheimer's and neurodegenerative decline. We always want to try and use that ALARA principle and get your dose as low as reasonably achievable. And the third one, I guess, is probably that the brain's not affected. So kind of similar point to, will I lose my hair? Is many people don't wear any head protection because the assumption is that the skull reduces the photons passing through and affecting your soft tissues, your brain matter. And whilst to a degree that is true, research has shown that there is a higher incidence of left-sided brain tumors in interventional cardiologists than there are in the general population. So this study found that it was like, I think it was 78% had left-sided brain tumors. And the reason why it's interesting that it's left-sided is because when you're normally facing, your left side is the closest to the C-arm and to the source of radiation. So it definitely shows a causal correlation between proximity and then developing those, brain cancers or tumors as a result of exposure.
So of the cardiologists that had brain tumors, they noticed that there was a higher, like a bigger preponderance of those with left-sided brain tumors. That's interesting. That's fascinating. And also, so I looked into that. I looked into, having a cap, having gloves. And so what I had seen is that, well, I heard that when the beams pass through soft tissues and then perhaps make it into your, cranium, they like bounce around, and if you were to wear a cap, there's nowhere for the beams to get out of. So
it's the same kind of principle. I think if you think about it as, if you're side facing to the X-ray source, why in that case would we wear lead aprons? Because it would enter through the soft tissue of, let's say, your shoulder and go into your chest cavity. So I think there needs to be more studies, more work with this. But from the concept or principle of that kind of line is, then we shouldn't wear any shielding. And of course, that is our mainstay of protection, is body PPE.
Okay. And then, speaking of caps, when one is, such as myself, because I'm a fellow, I'm in training now, and I had just recently bought my lead. How does one start the process? What should they look for? What sort of apron should they look for? What sort of additional accessories should they look for?
Yeah, absolutely. So, always, without doubt, it's personal protection. So your lead apron, and that might be a one piece. So, like just an apron, standard apron, or a two piece, vest and skirt, that kind of thing. And it's all about personal preference, like whatever your pain points are, or what fits you, or what you feel most comfortable in is the best option in terms of what choice of garment. We would absolutely always recommend a thyroid collar, because that will reduce your total body exposure, and it's one of the most radiosensitive organs that you have. So always a lead apron, and when we say lead, we always include lead-free, lead composite, all shielding type of materials. I would definitely urge all clinicians exposed to radiation to check with their RSOs, because not every lead-free on the market will protect in the same way. So there's various test data that, like, your medical physics departments will be able to point you in the right direction in terms of provider. And then it all depends on your proximity. So where are you in the room? And if you're quite a way back, you probably don't need all of the other additional accessories. But if you're close to the patient, close to the source of X-ray, you want to consider having as much protection as possible. And that can be eyewear, lead gloves, caps, other kind of novel accessories like the bat that Burlington have recently launched. But I would always consider and urge everyone to have a look at their room shielding before we're adding extra weight to their body.
The room shielding.
Yes.
Okay. And the RSO meaning radiation safety officer, is that correct? Okay. Okay. What if someone has chronic back pain? Do you, like, being in the pain field, a lot of people have chronic back pain, and that does not mean that clinicians don't have chronic back pain. So when you have someone that's like, oh, I need my lead, but like I have really bad back pain, what do you recommend to them?
Yeah. So we would always advise anyone experiencing severe back pain to visit their occupational health facility within their hospital. So normally you can get support, and likewise speak with your radiation techs to see what your dose currently is, to see whether you get a reduction in your lead equivalents potentially, which is going to make your lead apron lighter. Likewise, there's other novel shielding materials available. So things like Rampart or Radiaction, which a facility might invest in to reduce the dose and then enable everybody within the room to wear something that's considerably lighter.
So a lighter lead or a lighter lead-free material.
Absolutely.
Yeah.
I think all of those things aren't available to you. Is just simply speak to your industry rep, communicate where your pain points are, and then I'll be able to advise what kind of apparel is the best for you. And so usually a skirt and vest, like a two-piece, is going to be able to split the weight between your shoulders and your hips. There's so many different accessories that are available to help alleviate or support lumbar spine as well. So
the comparison between xenolite and lead, are they as safe as one another? Are they, why even make xenolite?
Yeah, sure. So xenolite refers to the technology. So at Burlington, powered by xenolite, xenolite is a patented elastomer technology, which suspends the protective metals within a matrix. So there's various different options you can get. So xenolite lead, for example, or xenolite lead free. And it really depends on your regulations. So as a global provider, we provide both IEC compliant and ASTM compliant materials. IEC is used in Europe and ASTM is used predominantly in the US. And we would always urge you to look at the attenuation performance. So lead has always been the historic best protecting metal, but we know it's very heavy. And so what our R&D team have done at Burlington is optimize particle size and protected elements to protect in the same way as lead and give the same protection as lead, but at a much reduced weight.
Okay. Interesting. All right. And then when it comes to different specialties, and I think you sort of addressed this, because within different specialties, you're going to have different amounts of exposure. Like interventional radiologists will probably have a much higher exposure than even our field in pain medicine. So do you recommend any different things for different specialties you see? And I know you worked in cardiac for a while too.
Yeah. So no, not really. It's the same principle. It doesn't matter what like speciality you're working in. If you're exposed to radiation, the concept is the same. Consider like the time that you're working with radiation, like length of exposure, where you are in the room, so your distance from the source. And your facility will determine what like lead equivalency that you require. And typically those that are working in interventional cardiology will require a thicker shielding material, so the lead equivalents. But in lighter use areas like endoscopy, for example, you might be just using a 0.25 apron, which is going to provide less protection, but in relation, it's the required level for your specialty.
Are there emerging technologies or sort of just advancements in the radiation safety field that have you pretty excited about reducing exposure, improving safety?
Yeah, there's been significant advancements. So even with the CR manufacturers themselves, so they're always looking at how their equipment can enhance image quality, but also reduce dose as well. But outside of the C-arms themselves, there's super novel shielding coming into the market, like Rampart, Egg Nest, Radiaction, which all reduce the dose before exposing the clinical team. And that's really exciting to see.
How do they
Yeah,
how does the radiation like reduce dose before? Because the ways in which I'm familiar with reducing dose are, distance from maybe the C-arm, for instance, using collimation with the C-arm, so reducing how much X-ray, I suppose, is released from the source, potentially having the source a little bit closer to where it's incident such that it reduces scatter. But what are these advancements like? How do they actually reduce the exposure?
Yeah, sure. So Rampart, for example, is just a combination of shields that like a protective bubble around the X-ray source and patient, whilst the clinicians the ability to access the patient, visualize them. So it's just that one's quite traditional, but it's been used in a novel way. And then Egg Nest, same kind of principle, like creating a nest around the patient, creating that scattered area. And then Radiaction's probably the most novel, and it's integrated with the C-arm that has flaps that come down from the image intensifier, essentially creating the collimation that you're talking about, but reducing the scatter coming out between the patient and the image intensifier.
And then lastly here, so what are some of the ways in which you remind practitioners, like including myself, how we can remember to actually practice radiation safety, techniques and protocols in the procedure suite or the OR? Like an example I'll give is that besides the one that you said where it's like, oh, I've had my kids, is that I think maybe 9 times out of 10, it seems that thyroid collars are not worn for the thyroid. And so what are some ways in which you sort of remind clinicians about that?
Yeah. I always think of radiation, like X-rays. When I'm doing any training, I always say that it's like, it acts in the same way as like a flashlight. So visible light acts in a very similar way to X-rays. And if we keep that principle, you would never go to like the hottest desert without wearing protective clothing, sunblock, a hat, glasses. And I treat it in exactly the same way. So if you think about going into your interventional room as going into the hottest desert, we would dress inappropriately. So think about all of those areas of exposure. So when it comes to the sun, for example, you know that you're going to get burnt or that you're going to develop skin cancers or aging if you're exposed to that level of UV radiation throughout either a short term or over the course of your life. And think of it exactly the same way, is that if you're not wearing the appropriate apparel to protect yourself, then you're going to get burned.
Oh, that's good. Okay, Leanne Miller, thank you so much for your time. Thank you for being here. I really appreciate the insights. And I love my lead, by the way. I have Burlington lead, and it's the Xenolite. It's light. It's cool. I'm happy about it.
Yeah, it looks like it fits perfectly, and I'm sure you had a great experience with your rep, James, as well.
James is awesome.
Yeah.
So much.
Thank you. It's been a pleasure to speak with you.